morning students. Today we will discuss the osteology of upper limb bones. Before going to discussion about the individual bones, we will discuss what are the bones or the skeleton to form the upper extremity. See here, the upper extremity skeleton. One is the clavicle. This is the clavicle. Next, posteriorly we can identify this is the scapula. This is the scapula. This is humerus. Humerus. This is radius and ulna. Here two bones are there. Lateral side it is the radius. Medial side is the ulna. Here the carpal bones. Here 8 carpal bones are there. 5 metacarpals. 1, 2, 3, 4, 5. 14 phalanges are there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. These are the upper extremity skeleton. So one is the clavicle. It is also called the collarbone. This is scapula. It is present posteriorly. It is also called the shoulder blade. This is the humerus. Humerus. This is the radius. This is the ulna. These are the carpal bones. Metacarpals. 14 phalanges. Next, what are the joints between these bones to make a one framework? See, clavicle medial side it is going to articulate with the sternum to form a sternoclavicular joint. It is saddle variety of synovial joint. Next, lateral side this clavicle acromion process going to articulate with the acromion process of the scapula to form a acromioscapular joint. Acromioclavicular joint, that is a plain synovial joint. Next, the scapula glenoid cavity. This glenoid cavity going to articulate with the head of the humerus to form a ball and socket variety of the synovial joint. It is a shoulder joint, that is a synovial joint, that is a ball and socket variety of the synovial joints. Next, this lower end of the humerus, it is going to articulate with the two bones. See, here lower end of the humerus, here upper end of the radius, upper end of the ulna. These three bones articulates together to form a elbow joint. That is between these three bones. That is a hinge variety of the synovial joint. So between these three bones, hinge variety of the synovial joints. Next, lower ends of this radius and ulna. These two bones here it is going to articulate with the carpal bones to form a wrist joint. This is a wrist joint. This is called the ellipsoid variety of the synovial joints. Next, here between the two bones there is a membrane is there, interosseous membrane, that form a superior and inferior radio-ulnar joints. That is the pivot variety of the synovial joints. Next, between this carpals and lower end of the radius and ulna, that is wrist joint, that is the ellipsoid joint. Next, there is a 8 carpal bones are there, 8 carpals from lateral to medial side. This is a scopoid, lunate, triquetrium, pisiform bone, trapezium, trapezoid, capitate, hamate. These are the 8 carpal bones are there. Intercarpal bones make a plain synovial joints. Next, 5 metacarpals, first, second, third, fourth, fifth. Between this metacarpocarpal joint, that is a plain synovial joints. Next, between this metacarpals and phalanges, there is a joint is there, that is a saddle variety of the synovial joints. Next another one here, first carpo metacarpal joint. It is also saddle variety of the synovial joints. These phalanges, see, we can identify this. This is a proximal phalanx, this is a distal phalanx, this is a intermediate phalanx. This is a proximal phalanx, distal phalanx, intermediate phalanx. Like this we can studying at the time of discussion. So like that 14 phalanges are there. 14 phalanges, 5 metacarpals, 8 carpals, 2 forearm bones, that is the radius and ulna. Next humerus, scapula. This is the scapula. See here, this is the scapula. This is the scapula. Next, this is the clavicle. These are the upper limb skeleton bones.